Hi, everyone, and welcome to this session entitled Co-Creating for Accessibility, Methodologies for Humanitarian Contexts. Today, we'll be exploring the recent research that GSMA conducted in Nairobi alongside UNHCR and Safaricom. The purpose of this session is to really introduce everyone into how human-centered design methodologies can be used in humanitarian contexts, as well as to share our findings of the research around the needs of people with disabilities in humanitarian contexts. We have a great panel lined up today to discuss this research. And I think before we get started, I'll hand over to them to let them introduce themselves. So maybe Catherine, you could kick us off.
Hi, everyone. I am Catherine Kaunda. I work at Safaricom PLC. Within Safaricom, I work in Financial Services Business Unit, which is well known as M-PESA. Within that business unit, I handle M-PESA for good. Thank you.
Great, thanks. Mark, could you introduce yourself as well?
Yeah, my name is Mark Kamau. I work at a company called BRIC, which is basically a technology company here in Kenya. We are the largest public Wi-Fi organization in Africa at the moment, but my role there is as a human-centered designer, and basically using human-centered design has been my life and my career for the longest time. So yeah, I'm glad to be here.
Great, and Alice?
Hi everyone, my name is Alice Schaus and I work for UNHCR, the UN Refugee Agency, and I work in our innovation service focusing on an initiative called Connectivity for Refugees, and my focus is East Africa and I'm based here in Nairobi.
Great, thanks so much everyone. We're really excited to have you today, and we're going to have a panel discussion about the research that all of us were involved in. But before we start that, I thought I would give a little bit of context on this project and what we did. So we've recently put out these two publications about this research. The first is called Human-Centered Design in Humanitarian Settings, and that really documented the methodology that we used and shared tips for how to use human-centered design in humanitarian contexts, and more specifically, how to adapt those tools to make them accessible for people with disabilities. So along the way, we needed to shape and adapt the research tools we needed to make them accessible, and we documented that process so it could be used in the wider sector. The second research piece that we put out is called The Digital Lives of Refugees and Kenyans with Disabilities in Nairobi, and that documented the research findings. So to give you a little background on why we conducted this research, UNHCR and GSMA teamed up last year to look into how refugees are currently using mobile technology around the world. And we put out a research report called The Digital Lives of Refugees that looked at 3 different humanitarian contexts. So Bidi Bidi Refugee Camp in Uganda, Kaziba Refugee Camp in Rwanda, and several urban contexts in Jordan. And as part of this research, we measured the mobile disability gap in humanitarian settings for what we believe was the first time. And we found that people with disabilities in humanitarian contexts are less able to access mobile technology. There are 10.6 million people with disability that are forcibly displaced globally, and this population is at a higher risk. They're at higher risk of violence, exploitation, stigma, but also as more humanitarian aid is being delivered through digital channels, they're at a higher risk of being left behind. They can fall through the cracks in accessing these services unless those services are designed particularly to fit their needs. So we conducted this research in order to better understand, building on that research, the lived experiences of people with disabilities in humanitarian contexts. We wanted to understand the lived experiences of how they're currently using mobile technology and the opportunities for mobile technology to bridge the gap to accessing services that are otherwise inaccessible. So with this project, we really had 3 main objectives. 1, to better understand how people with disabilities in humanitarian contexts use mobile technology. 2, to document the methodology that we used and provide lessons to others. And 3, to come up with some really tangible ideas for our partners in the wider sector to improve current offerings. So these are the research questions that we use to guide the research. Again, it's really about digging into the lived experiences of people to understand how mobile technology is currently being used and can be used in humanitarian settings, and understanding what services are not yet accessible where mobile technology has the potential to play a transformational role. As I mentioned, we worked in the context of Nairobi, specifically with Somali and Congolese refugees alongside Kenyans with disabilities. As you see, we had a relatively small sample size because it's deeply qualitative research, deeply participative, so we were able to engage with this group over time. And we'll dig into this more in the session, but we used human-centered design methodologies that really put marginalized users at the center of the process. And we started with these relatively open-ended questions to allow the users themselves to guide us to the thematic areas that were most important to them and their lives. And the last thing I wanted to note on this is that it was really important to us to feed back to these communities and include them from really the inception of the research all the way through the end. So we're currently in the process, working again with our project partners on this line, to feed back the research results and get their feedback on the research. So that's currently ongoing. And then I thought I would just outline the thematic areas that this research ended up focusing on based on user needs. And then we'll kick over to the panel discussion. So based on people's lived experiences, their preferences, their desires, the frustrations that they were having, we ended up focusing on these 4 thematic areas. First, mobile phones and mobile services. Second, health services. Third, financial services, which in this case really meant M-PESA because that's what most people were using to access financial services. And fourth, refugee and disability support services. So here I think I will stop and switch over to our panel to let them tell you a little bit more about this research and how we went about it. Great, so Anise, maybe we'll start with you. Why is it important to consider people with disabilities in humanitarian contexts?
Thanks, Zoe. Yeah, so people with disabilities are amongst the most vulnerable population in the humanitarian context and can often be left out through traditional means to communicate with communities or through service delivery. And because of that, UNHCR, as a protection agency, we are responsible for promoting the meaningful participation and leadership of people with disabilities. Furthermore, improving the access to digital services for refugees or other forcibly displaced people with disabilities can present an important opportunity for people with disabilities, since they are increasingly enabling persons with disabilities to get access to education, financial service, skills development, and employment. So they can really present an opportunity for those communities which might be left out, and also digital technologies themselves can enable them to receive information and content in a format which is more appropriate for them, and so they have more options to get access to service.
Great, thanks so much, Anise. Now, Catherine, before we started this project, one of the reasons we selected Safaricom as a partner is we knew you had a strong commitment to this issue, to serving customers with disabilities and integrating them in your work. Can you tell us a little bit about why Safaricom has chosen to prioritize this issue?
As you say, Safaricom is a purpose-led organization that seeks to transform the lives by taking advantage of technology to link people to opportunities. We understand that if we take care of people who are our customers and employees, they will in turn take care of our business. That is why within Safaricom, we put our customers at the center of what all we do. As you know, persons with disability form about 10% of every population, according to World Health Organization. There is a huge number that cannot be ignored or left behind. At Safaricom, we believe in touching the lives of all which is in line with our vision of transforming lives. So we give attention to the needs of persons with disabilities, even as we serve our customers. I would say we are notoriously customer obsessed. Thank you.
That's great. Thanks so much, Catherine. Mark, now we brought you in to really help us with engaging with the end users in your role as a user-centered designer. Can you tell us a little bit about what human-centered design actually means?
Yeah, so usually we get opportunities in our positions to deal with different situations or challenges that face people around the world. And traditionally, people have taken their position and their expertise and decided what the solution would be, and then they will go and deploy that solution so that the beneficiaries of the solution should engage with it and use whatever solution they brought to the table. Human-centered design advocates for the opposite. It's the understanding that the people who are closest to the problem have contextual intelligence that we might not have in our offices or in our capacities as people who hold the power to actually implement solutions. So human-centered design is simply a process that allows you to center the people who are closest to the problem and then surround them with the right people, ecosystem of other stakeholders, and engage them so that the solutions that come to solve whatever the problem or challenge is are informed by their contextual knowledge and their lived experiences. And so it's a very powerful because it allows for you to learn elements about the challenge you're trying to solve that you'd otherwise not be able to coming in as an expert. And so that's why I believe in the process and I think it works.
Can you tell us a little bit, Mark, about why we thought this methodology would be particularly well suited to this context, working with people with disabilities in humanitarian contexts?
Yeah, it's a very good question. Traditionally, you have traditional ways of engaging with people. For example, just doing traditional interviews sometimes don't work, especially when you look at the people we are dealing with. We were dealing with people who had hearing and visual impairment. And human-centered design allows for the flexibility and in methodology and ways of engaging with people that allows for us to engage using a non-traditional communication methodology. For example, we would use clay for people to actually mold out ideas and concepts because they couldn't see, but then they have a very strong sense of touch. And we would use drawing, for example, for people who cannot speak, and sign language. And so then you get much deeper into the way you connect with people by using non-traditional methods. And it focuses on the why. For example, people could have a certain situation and could have a certain perspective or mindset or aspiration or frustration. Human-centered design goes to the root of why they have that, they feel this way or they act that way. And understanding the why gives the insight as to why the symptom is manifesting. And so human-centered design allows for flexibility that traditional research methodology simply wouldn't, especially with the target population we're dealing with.
Thanks so much, Mark. Alice, could you walk us through a little bit about how the research process actually worked? What were the main steps we went through?
Yeah, sure. Thank you, Zoe. Yeah, so UNHCR was involved throughout the research process, and I think you can mainly summarize the process in 4 different steps. So the first steps was the design and research preparation, and so GSMA with Butterfly, they reached out to key stakeholders to ensure that the tools which they were planning to use were suited for the population, and so several rounds of iterations were made over the course of a month in consultations with organizations working on these issues, and then they were also trying to locate and define what are going to be the key communities they are going to involve in this project. Then the second step would be all the research activities. So as Zoe mentioned already, this research focused mostly on refugees from Somalia and from DRC, and as well as some Kenyans. But in addition to those participants, there were also some translators who spoke the languages or were fluent in sign languages who were involved in the research activities. And then the research consisted of using a lot of human-centric design tools, such as user journeys, communication maps, daily diaries, or other innovative tools to really get those communities to express their feelings and their thoughts. Then the third step was like capturing the results and recording the results. So the participants were able to provide feedbacks on some of the results which were captured. And then the results were coded, patterns were noted, and then I remember that they also did some work on creating personas, so fictional characters that took into account participants' daily routines and expectations, and that those personas were very helpful in the workshops we had later on. And so, which brings me to the first step of the last and fourth step of this whole research process, which was the co-creating workshop with the relevant stakeholders. And so we had a workshop to discuss potential solutions and ideas around the topics which had come out during the research. Unfortunately, because of COVID, we were not able to do it with the end users, and so we had to do it remotely over Zoom, but because we had all those personas and all this research, it was really helpful to really use those to elaborate on solutions which could help refugees with disabilities. And then to make sure that and to validate the results, Mark, he went back to the participants and did a sort of survey just to validate some of the assumptions we were making during the workshop because we weren't able to include the participants. Yes, and that's basically those are basically the 4 steps of this research process.
You're on mute, Zoe.
Thank you. Mark, I know that you were really the one who was interfacing the most with the actual end users on the ground. Is there anything that you want to add to that around how we went about this research and what it was like interacting with people?
Yeah, I mean, it was, first of all, for me, it was quite a different process because of the stakeholders we were dealing with. And we had to think about quite deliberately, in fact, before we designed the tools that we were going to use, we had to interact with different stakeholders, who, organizations that deal with people with disability, experts in people with visual and hearing impairment. We had to seriously consider the stakeholders we were going to deal with. And as a result of that research, that was quite extensive in on itself as desk research and interviewing stakeholders. We were able to actually then come up with custom tools. For example, and that's very important to actually center the people you're going to deal with or to interact with in the process of creating the tools. And through that process, we are able to actually create tools, test them to make sure that they actually would be effective before we actually deployed them. And that was quite interesting. Alice has quite well, I mean, in a very well elaborated or summarized the processes. But these tools were, indeed focused on learning as deep as possible, engaging as deep as possible with the community and with the challenges that they face and presenting their perspective. And so we had to think to ourselves which tools would most present the perspective of the end users when it comes to health, when it comes to using technology, when it comes to how this affect them on a day-to-day basis. And so these tools involved one-to-one interactions and collective interactions, and that worked out pretty well.
Great. And Catherine, as you say, Safaricom is customer obsessed, so I would say that it's probably quite natural for you to do this type of research. I'm curious about your experience with the process What did you think of it? Was it similar to what you'd done before, or was it quite different?
With the process, we received a deep insight through the process, and it enabled us to identify some of the existing gaps and challenges faced by persons with disability, especially those who are living in refugee camps, because that's the area that they concentrated on, particularly the deaf and the blind. And then it also enabled us to brainstorm as a team to come up with various solutions to address these gaps. Having other participants in this process also brought in diversity of thought, perspective, and experiences that were key in formulating solutions. Yeah, that's it.
Great. Thanks. Thanks, Catherine. Now, to go over to the findings a little bit, Alice, can you walk us through some of the main barriers that we found through this research process?
Yes, of course. Yeah, many findings and barriers, but also opportunities came out throughout the whole research process, which are very nicely outlined in the report GSMA has published. But I'm going to briefly mention a couple of them. So first of all, communication challenges. So we realized through this research that communication barriers for refugees with disabilities, which vary from interacting with service providers and members of their communities to receiving reliable information and reporting emergency, are really a barrier. And it not only prevents them from accessing basic services, but also from being included in society on an equal basis with other people. Then another barrier was the lack of digital literacy. So the level of digital literacy of people with disabilities is generally lower than among people without disabilities. And even though some of them had smartphones with integrated assistive tech features, they were not always able to use them or knew how to use them. And so they would struggle to use their phones independently and requiring assistance from any to access services or to read messages, send messages, make calls during their day. Then some of the participants also expressed a lack of opportunities to contribute in their communities. So they may feel empowered when they can contribute and when they have that possibility, but many times because of physical and information barriers or even like high levels of stigma and lack of accessible capacity, they struggle to build opportunities which can lead to income generating activities. And then last but not least, which is linked to all the points I mentioned, is a high level of dependencies. So they feel like they have limited autonomy and they are always dependent on people around them or in their household to fulfill basic needs, whether it's to eat, hygiene, healthcare, and they really express a strong wish and desire to be able to manage their affairs independently and safely.
Yeah, I think that was one of the most interesting points for me, was this real desire to be autonomous that we saw among many different user groups. And especially among the visually impaired, people expressed feelings of dependency and reliance on just a few small people, or a small network of people who really supported them. And for me, that underlines the importance, one, of training people so that they can use mobile technology to be more autonomous and take control of their own lives, and two, the importance of integrating mobile technology with community mechanisms so that we're strengthening linkages on the in-person basis as well, because as much as mobile technology can help, of course, it can't solve these issues on its own, right? And so I think we as development and humanitarian practitioners have to always be looking at those in-person linkages as well. So that's definitely one that I found the most interesting. I wondered, Catherine or Mark, if either of you had thoughts on on which research findings really struck you as very interesting.
I'll let Catherine go first.
The research findings were good because Safaricom continues to innovate products and services to meet the changing needs of our diverse customers. As such, we will also leverage on the findings and learnings from the research that was done to come up with solutions that will continue to position the company as one of the most innovative brands in the region. So those findings are going to be used within the organization to come up with solutions that will cater for this segment of customers that we have. Thank you.
That's great to hear. Mark, what research findings struck you?
Yeah, for me, yeah, it was a whole mixed bag. It's difficult to pick one, but one of the tools we used was a lifestyle diary where people would have actually write the things that happened in the course of the day, and things that caused them frustration, things that caused them joy, and when they felt helpless. And especially for the blind, like Catherine is saying, like Alice is saying, the sense of helplessness and the sense of almost total dependence on others for their own lives was very difficult. And the other part that was difficult also is how much the rest of the world just moves on in spite of this community existing amongst us. How much in my own life, for example, when you look at before this research, there's a lot of products we use, there's a lot of products we design that doesn't really include or consider people with disability. And for me, that was quite jarring, that how unseen this community is, how invisible the community is to the rest of us. And it was for sure eye-opening.
Definitely. And that's something I think we saw when COVID-19 arrived as well, which of course happened in the middle of this project, is we noticed that some of the information that was being produced around COVID-19 was inaccessible to this audience. So in some ways they were left behind.
Yeah, in fact, the government gave a hotline where they said, if you have any COVID-19 information around you, here's the hotline, and you should call this number. And the people who couldn't speak were asking me, how are we supposed to call, the number because we cannot speak? And that's it's a classic example of how unintentionally we exclude people who have disability.
Yeah, and I think one of the... Oh, go ahead, Catherine.
Okay. Just also to add on what also came out strongly in the research was the financial literacy, just helping most of these customers. We found out that they're not aware of some of the products that we have. So financial literacy was a key item that we picked that needs to be worked on, just to ensure that our customers understand the offering, what we are offering them, and what is available for them, because that is an area that was really highlighted, that came out from the research.
Yeah, definitely. And for me, I think some of these were quite easy wins that, come out when you adopt the user perspective, right? So things like there are accessible services that Safaricom has already created, but people don't know about them. We need to raise more awareness and increase digital literacy. Or you have a hotline to access information on COVID, but people who can't hear and speak can't access that. We need multiple channels to access information. Or I know in terms of disability and humanitarian support services, there are a lot of support services out there, but they're not, information about them isn't centralized and often isn't consistent. So how do we make sure that that's all in one place in an accessible manner? So these were quite, in some ways quite simple findings, quite simple wins, but I think it all comes from when you really put yourself in the end user's shoes. Alice, do you have anything to add, or maybe you could tell us a little bit about what UNHCR is doing off the back of this research?
Yeah, sure, I can answer to that question. So yes, as a result of this research, we have decided to launch an internal call for proposal to fund projects which address some of the main barriers faced by refugees with disabilities. And so This is an internal call for all of our UNHCR operations to potentially apply with projects which might be linked to some of the priorities linked to barriers faced by refugees with disabilities. And some of those are, for example, looking at tackling affordability roadblocks. So we know that persons with disabilities in general have a lower income than non-disabled refugees, and so the cost of a device or connectivity can be quite burdensome. So looking at projects which are tackling that challenge. Then we're also looking at how to make information more accessible and better engage with those communities using technology. And then we're also going to focus on building digital skills, so linked to financial literacy, because we've realized during the research that many are not aware of all the different tools available and how they can be used. And lastly, also looking at enhancing livelihood opportunities, because we know that having digital skills can lead to livelihood opportunities, especially with the global trend of digitalization in the labor market. We really believe that this group should not be left out and should be able to also achieve independent living. And linked to all of those different topics, we already have one project which we are looking at the moment, which is to improve the accessibility of UNHCR's call center in Kenya. And so our call center here in Kenya is a very traditional call center where refugees can call, but the only way we are able to respond is through audio, which obviously leaves a lot of people out who are not able, who have communication challenges or communication disabilities. And so we are currently exploring alternative communication channels, such as, for example, video calls with call operators fluent in sign language, or two-way SMS channels. And so we'll be exploring those different channels over the course of the coming months to come up with a solution, and also by taking into account some of those lessons learned from this research, even in terms of the design and the human-centered design, and really trying to also involve refugees in the process of designing that solution.
Excellent, thanks so much. And the last question I had was for you, Mark. I know you've been working as a UX designer based in Nairobi for a long time, and I wondered if this project had shifted your perspective at all.
Yeah, I think it's a good question. I think that the way I practice my work changed completely after doing this project. I'm lucky enough to be involved in fairly different kinds of projects where, for example, we are working right now with the German government to help spread diabetes information amongst communities. And traditionally, I never had this perspective that we can design and include people with disability. And right now, every project, it doesn't matter who approaches me or what project we're doing, I'm actually insisting that we add a component for people with disability, because for the longest time I didn't consider or see, and I'm ashamed of that I designed many products, but not without a focus or inclusion of people with disability. But I'm hoping that now that this project opened my eyes, that I can continue to connect with the community and engage with them, and include them in everything I do as much as possible. I formed a community with them. I speak to them today. Like I signed up for sign language classes because it just opened such a warm community for me, and people who are unseen. And if now I want to use my the space I've got and the little power I have to make sure they're as included as possible. And that's thanks to this project.
That's great to hear. Yeah, and maybe just to note, since we have a little extra time, that Mark is currently helping us turn these research reports into something that's more accessible to the people who participated in the research, so the communities who are actually doing the activities with us to gain this information, because we think it's important to feed back how their words were actually turned into something, a research product that's useful to the wider humanitarian and mobile network industries. So we're interested in, feeding back and letting them know what's being taken forward out of this research, and also collecting their thoughts on, did we accurately represent your experience? So we're really looking forward to doing that.
Yeah.
Now we have a few minutes. Are there any last words? Does anyone want to say any words of conclusion?
Yeah, I think that the fact that GSMA, UNHCR, Safaricom decided to do this is very important, and I think that I'm hoping that the tools that have come out of because one of the aims of this was actually to also help others see how they can use a similar approach in reaching out and engaging and including people with disability. So I would say, if you haven't had a chance to look at the results of the report and the tools therein, please take a look and see if you can use those tools in your own practice or in your own engagement with people with disability.
I would like to add that really, I think Zoe, you started with that, given the scale of this issue, more than 1 out of 10, I think according to WHO, it's 15% of the world population has any kind of disability. So given the scale of that issue, I think it's really important that service providers or humanitarian organizations also really try to include as much those communities which have been left out for a long time. And I think we have a lot of tools and we have a lot of technologies, and so we just have to make sure that people are know how to use them, have the right skills, and and otherwise further develop those kind of tools. But I think we have a lot of the technology, we have it already. It's just about using it.
And I can go on. Just to add on what we've done in Safaricom, because there are certain things that we've done as an organization even before this, just to show that the human-centered design really is a good approach to building up solutions. We enable our visually impaired customers to keep track of their M-PESA balance through interactive voice response, which is the IVR. The IVR functionality reads back the current M-PESA balance for the visually impaired customer. So this idea came from them, actually from a focus group. I'm just emphasizing why it's important to use the human-centered approach, because like this solution came as a result of engaging the visually impaired and asking them questions, and we are able to leverage on the IVR to deliver for them M-PESA balance inquiry. We also partnered with DOT Incorporation, a Korean organization, to deliver DOT Braille Watch that enables our visually impaired customers to read the M-PESA messages and other SMS notifications in Braille. Yeah, and apart from that, we also actively engage persons with disability through the organizations like Kenya Union of the Blind, and I know that one of the things we've done is to register the visually impaired across the country and those who are low vision, and this has enabled us to whitelist them in our system, such that when they call our contact center, we are able to reroute them to a dedicated team for efficient service delivery. So these are some of the things that we have done to help the persons with disability within the organization as our customers.
Yeah, great. Thanks so much, Catherine. Yeah, I think that the reason that we engaged UNHCR and Safaricom as partners in this research is you're both real leaders in moving this forward, both ensuring that refugees have access to connectivity and that that's a human right from the UNHCR perspective, and Safaricom's really been a leader in making sure that people with disabilities can access the services that they provide. So it's really been a wonderful project engaging with everybody, and it's been a really interesting panel discussion today. So thanks so much for contributing, and I think I will leave the rest of the time for question and answer. So I think now we will turn to those. All right, hi everyone. We had a quick costume change there as we're switching over to the live event now for the Q&A. As a reminder, you can ask questions in the Q&A function on Zoom. If I can have the panelists come off their muted video, then we can switch over to that. And we already have a few questions coming in. So the first question that came from the audience is about digital literacy. Digital literacy is a problem that came out in the research that affected the users with disabilities that we spoke to in Nairobi. But this, of course, cuts across various community groups. So this audience member is wondering what potential solutions exist already to address barriers of digital literacy. Alice or Catherine, does one of you want to kick us off on that?
Yeah, sure. I can start, and then Catherine can continue. So yes, I do think that digital literacy. I think this research, but also other research such as the digital lives of refugees, that research undertaken by GSMA, have shown that digital literacy is an issue and prevents, for example, refugees from accessing certain services, or makes them need assistance when they want to withdraw money from mobile money agents. And so in order to address that challenge, I think it's important for different actors to be involved. Certainly the mobile network operators who are providing those services, because it's in many cases when accessing those services, especially for example mobile money, I think it's helpful if, for example, mobile network operators or agents are able to educate customers on how to use and access those services. Yeah.
Great, thanks so much, Alice. Do you have anything to add to that, Catherine? Is Safaricom taking initiatives to address this issue of digital literacy?
Yeah, we noted that digital literacy is a big issue, because we noted that most of our customers are not aware of some of the products that we have, and it's because of the language barrier that they're not able to have access to those products, and also some of them are disadvantaged because of their economic status, and they're not able to have access to internet to help them get some of the knowledge that they need. So we noted this is a key item that needs to be addressed, and some of these solutions, as Safaricom, we may not have an answer to all of them, so partnership really works. Yes, when we partner with some of the organizations that are able to step in and help in one or the other, it really helps. Yeah, so we are looking at disseminating some of the information in mother tongue, so that they can understand some of the solutions that we have for them, like, credit facilities that we have. Yeah.
Great.
Just to jump in real quick. I wear two hats in this conversation. So in the design research for this project, I was contacted by Butterfly Works, a social design agency from the Netherlands, and on behalf of them, I was conducting the design research on the ground. And they basically focus on using co-creation and design approaches to make sure that people around the world take part in creating the futures they want to see. But to answer the question, as BRIC we are the biggest connectors of public Wi-Fi to people around the continent. And one of the things indeed that has come across, even for, as one of the biggest challenges, is indeed lack of digital literacy. And one of the things we've been trying to do, and we've been partnering right now with the German government to do a project that basically is called We Connect. And the idea is to create a digital literacy toolkit. And the idea is whenever we deploy internet connectivity, we can also deploy this digital literacy toolkit. And it is as basic as how do I connect to the internet with, and how do I use the internet as a tool to improve myself and my community socially and economically. And so BRIC is taking this effort forward to develop this toolkit, and also to look at the internet as not, to look, especially for Africans, to look at the internet not just as a source, an extractive source for information, but how can we also collectively share our knowledge on the internet. And I think that this project is a prime example of how to improve digital literacy amongst people.
Definitely, and I think from a GSMA perspective, it might just be worth mentioning that we have as well the MIST, that's MISTT toolkit that has modules for teaching digital literacy as well. And that's open and available to the wider sector if anyone's interested in those resources. All right, moving on to the next question. We have one from Jude about the research findings. He noted that one of our initial research questions was about which services are not yet accessible to people with disabilities in these contexts. And he was wondering if we could elaborate a little bit on what we found in terms of what services were not accessible. Mark, do you wanna start us off on that one?
Yeah, I think that, so in terms of accessibility to services, yeah, it depends on how you look at it. So there are services that are available, but for one reason or the other, the community doesn't have awareness of these services, and that limits the accessibility. And then there are services, for example, and Catherine has mentioned quite a few of them, financial services, that are available for them to do mobile mobile financial services. But then they've been designed, but somehow the communication of how that they exist and that they're available to them doesn't reach people. So then there's a barrier there. And it's also, even as refugees, there are services that UNHCR provides and different agencies that are meant to support people with disability that provide these services, but for some reason, for one reason or the other, the communication doesn't reach them. So there is awareness as a barrier, and also the accessibility as a barrier. How services are designed also can be an issue. And so both aspects are important in that sense, for financial services and other services.
Great, yeah, and maybe Alice, could you share a little bit about the UNHCR service that's currently being adapted?
Yeah, sure. I think so one good example is, for example, the UNHCR call center. So the way the call center works at the moment is that you can call the call center, but the only way is, it's audio. So for people with communication disabilities or hearing disabilities, it's not as accessible. And so for that reason, we are currently looking at a project I mentioned during the initial panel discussion, which is to improve the accessibility of the call center in Kenya, and looking at adding additional channels which don't rely on audio. So we're looking at video, SMS channels, so that especially refugees with hearing disabilities will be able to access the service and be able to speak to our call operators or communicate with our call operators and to get assistance.
Great. And then finally, Catherine, could you maybe talk about some of the findings around M-PESA and the way that we're hoping to make M-PESA as one of Safaricom's flagship products more accessible? Oh, Catherine, you're on mute, I believe.
Yeah, with the M-PESA, what we noted that the visually impaired were not able to keep track of their balance, or rather their M-PESA money that they have. So we decided to leverage on the IVR to help
I think Catherine may have frozen.
As go to data, once they dial the IVR, then the IVR will be able to read back to them their balance as at that time. Yeah, but our plan is basically to have M-PESA on voice. That would be the long-term plan that we have. Yeah, but as a temporary measure, right now is the IVR reads for them the M-PESA balance. Anytime when they've done a transaction, they're able to dial the IVR and it will be able to read back for them. That is for the visually impaired. Yeah.
Great, and Catherine, just following up on that, we have one more question from Charles here who wants to know, can IVR be used in other parts of the process? Is that a technology that can be leveraged for this population?
Yes, I know IVR can be used to carry out transaction, but that would be more a traditional way. There are more other technologies that are available, like artificial intelligence or conversational IVR, that can be used as at now, instead of taking the more traditional way of using IVR to carry out transactions. Yeah.
Thanks, Catherine. And then we have two more questions that I might combine into one. If anyone has more questions, feel free to drop them in the Q&A. But we have one question from Max about what's the way forward for other humanitarian organizations to ensure that services are designed inclusively. And someone else has asked about adapting this to the context in Uganda. And I think this is the #1 reason we created the methods report, was so that other contexts, other partners can repeat this process. But maybe Mark, could you talk about the toolkit a little bit more and how people can use that to make their own services and products more inclusive?
Yeah, I think that part, like you say, part of the aim of doing this was, as we were designing the tools, Butterfly Works taking the lead to design the tools, is to think about, okay, the methods that we are using here, can somebody else who was not part of this research use these tools when they want to include people with disability in their programs? And so what set of toolkits can we put together so that you can go take a look and then see if you can employ the same methodology as you're trying to engage people with disability. And my hope is that people can download the toolkit and then see if they can use it, and if they need support to use it. Of course, there are people around who are able to help you, contextualize it more. Butterfly Works as an organization, that's basically what Butterfly Works does. And so it's potentially possible to actually do that. Yeah, and if I can, be of help in the process where you're trying to adapt the tools, yeah, we can support you too. But the hope was that it's as clear as possible, as clear as we could get it, so that people can adapt it. So my sense would be, the first step would be to actually take a look at the tools and then see, do they make sense for what you're trying to do? And if you need any help, then there are avenues for you to get support.
Great, and at least from the perspective of UNHCR, do you think there's any lessons particularly for humanitarian organizations about how to design program inclusively?
Yeah, no, I think it was really interesting to be part of this research. And I think it's really important to focus on including vulnerable communities or people with disabilities in the design process as you design a solution. And then, what we're going to do here in Kenya is take an approach where we are piloting the solution and continuously getting user feedback, and so that we can adapt the solution before expanding to different, to other regions in Kenya. So we'll start with Nairobi, or even before making any recommendations for other countries. So yeah, including people with disabilities, or even working directly together with organizations which work with people with disabilities. I think that's something we've learned throughout this process.
Yeah, and I think that, it doesn't have to be, because one of the things that I've noticed in the past is that people think that they somehow have to make absolutely radical changes that are unrealistic and so on. But it even can start with the question, how do people with disability use our product or service? And just understanding that is very, very valuable. And then seeing where the gaps are and saying, what are the changes we need to do to make our product or service more accessible. And I think any organization can do that. And I think it just takes, it takes some effort, but it's completely doable by any organization or product development.
Yeah, and I would like to add, I think also designing products which are more accessible to certain communities, for example, such as, refugees with disabilities or so, can also be product which can be more accessible for other communities which maybe we haven't, initially were not the target. So we know that especially women or older people really have lower accessibility to connectivity or lower ownerships of mobile phone or lower digital literacy. So some of those products could beyond just the community of refugee of people with disabilities also address challenges faced by other communities.
Definitely. Thanks so much, both of you. And I think that that's including the end user, the customer in the humanitarian world that might be refugees or displaced people throughout that process is really one of the key messages of our research. And of course, that's something that the private sector has been doing for a long time. And I think the humanitarian sector could learn from them. And that's one of the reasons that partnering across and between types of organizations is really key. Catherine and I were talking earlier today about how this process was really enriched by having representatives from the humanitarian sector, from UNHCR, from the private sector, from Safaricom, and from the creative on-the-ground human-centered design research perspective with Butterfly Works and BRIC. So it really was quite a collaborative process. So I'd like to say thank you again to the panelists for participating in this panel, as well as the project. And both of the reports that we mentioned today are available online on GSMA's website, so feel free to check them out. And then just to end, I'd like to thank our donors. Our program is funded by FCDO, and so I wanted to say thank you and thanks to everybody for attending the session today.